The network spans across sort of London, the south central aspect of England, and also the southwest, and that's one of 4 thalassaemia networks in England. And through some engagement with patients and hearing their thoughts, nutrition has come up sort of repeatedly as an area where patients would like more input and more direction. So thanks to Romain and Rowana for that particular request. We set about as a network, myself and Bernadette Hilton, one of the nurse specialists that's associated with the network, trying to source someone who may be in a position to provide that expert input. And we gladly found now Dr. Claudine Matthews, who I think will do a better job at introducing herself and her background. But she's agreed to do 4 sessions for us on thalassaemia and the role that nutrition plays. Hopefully you've all seen the breakdown of the content across the 4 sessions and have signed up to all 4 sessions on the ticket tailor. But Dr. Matthews has kindly agreed to facilitate those sessions, so we're very excited to have her, and I'll let her do a bit of an introduction as to what her background is and what the 4 sessions will cover.
Right. Thank you so much. Thank you, Stuart. Thank you, Romain, for this wonderful invitation to share my thoughts and my insights on nutrition in thalassaemia. I'm really excited to be doing this. It's the first time that I'm speaking on nutrition in thalassaemia, and really looking forward to be able to share, but also learn from you as well. So just a little bit of background. I am a dietitian by background. I have been qualified for a good number of years. But as you can see from the logo on the second screen, my area of interest over the last couple of years has been in the area of sickle cell rather than thalassaemia. And the only reason why that happened is because whenever I was introduced to thalassaemia patients when I worked in a sickle cell service, nutrition always sort of came up, you know, and I would hear of nutrition, but I wouldn't hear of nutrition in sickle cell disease. And so that became my area of focus and also the focus of my doctoral research project. But I'm really excited to be able to share as I said, my knowledge and my insights on thalassaemia as well. There's some overlaps, but definitely very clear distinctions between the 2 conditions, both being a hemoglobinopathy. And hopefully over the next 4 sessions, I will be able to give you some helpful insights, some useful information that will help you to better manage your thalassaemia and the complications that you have from the treatment. I won't have all the answers. I will say that to you. I won't have all the answers because this is a developing area. If you look even at the thalassaemia standards, there's not a lot on nutrition in there, but hopefully moving forward, that will change. And some of the sort of the insights and the knowledge that we will share on this course, this 4-week sort of program, you know, will be able to be included in that moving forward. So I'm looking forward to learning from you, which is why on the next slide, I wanted to start the presentation by gaining some insights from you. And some of you have already been really good and put some questions in the chat. So I thought it'll be really helpful for just a few minutes if you can in the chat just say what is one of the main nutritional challenges that you experience, so I can get a sense of what people are you know, wanting to find out more about, but also one expectation of the session. Now, Stuart has kindly already mentioned that some people have put in the chat questions around iron overloading. There was a question around minerals and then enzyme deficiency. So if for the next 2 or so minutes, if people would kindly just jot down in the chat, you know, if you've got a main nutritional challenge, just jot that down. I will make a note of it. If it's not within this talk, then obviously I will include it in the next, you know, the 3 other workshops to follow. But if it is in the talk, obviously I'll mention that. But I'll be making a note so that I can ensure that your questions will be answered. And if I don't have the answer to hand, I will definitely make all the effort to try and find the answers. So it's now 19:11, so 11 minutes past 7. So if for 2 or so minutes we can just get people to drop the main nutritional challenge in the chat. And then by 13 past or 15 past, I'll just go through that very briefly, if that's okay. So I'm going to also have a look and see what people are saying, as I can see.
If I can just say as well to people, I noticed that my chat was directed directly to Romain. So just make sure you change who you're sending the message to. You can send it to the whole meeting group chat. Let me know, Claudine, if you'd like me to read any of these out.
I can actually see it now, so I'm just quickly scrolling through as well. So there's a lot of questions coming in about iron overload, and thankfully the focus of the session is on iron overload, so you will get a fair sort of share of information and tips as to what you can do to try and improve that. Evening, so blood pressure. So there's some questions about the general diet as well. About antioxidants. So really good challenges coming through, which is great. We'll just go for another minute or so, and then I will start the presentation. Great. So I'll just quickly go through some of the challenges that people have mentioned. Right. So some of the points, as I already mentioned, lots of questions coming through about iron overloading, and we'll be covering that in a great detail today. There's some questions on blood pressure, some questions on antioxidants, which we will cover in another session. That will be session 3, I think. There's some questions around weight and just general sort of healthy eating within following a thalassemic, diet. Let's see if there's anything else. What kind of food should we take more? Plus what kind of food to take in order to gain weight. So there's weight gain. Great. Excellent. Good. So it's now 14 minutes past 7. That's really good. Thank you so much. I've made a note of it, and hopefully I will, be able to go through the others as well, sort of after the presentation. But I wanted to move on so we can get through the content that I have in the presentation. If you have any other questions, then please just drop it in the chat. And hopefully we'll be able to, once we get to the question time towards the end of the presentation, I'll be able to sort of look at those again and try and answer them at that point. So if I can move on, that will be helpful. There you go. So let's just go back. Yeah. So the presentation this evening will have 3 parts. The first part is literally just to give you context for healthy eating. So speaking about the foundations of diet and nutrition, but specifically looking at general healthy eating principles. That's not only for patients with thalassemia, but for all patients. And then we will bring that in the context of diet and nutrition in thalassemia patients. Part 2, we'll look specifically at diet and nutrition in iron and iron overloading. So we'll look at some of the pathology, the clinical features, the complications, and the treatment, because it's really important for you to understand, that side of things, the medical side, in order to know what to do in terms of the nutrition. We'll look at then the management of the impact of iron overloading on diet and nutrition, specifically looking at 3 problems associated with iron overloading, and that's malnutrition, failure to thrive, and then chronic anemia and fatigue. And then the part 3 will be about lifestyle and empowerment, and this is just helpful tips and daily actions that you can take to help improve your overall health and well-being. So just a little bit about me. I was born in South Africa, in Cape Town, and experienced racism and marginalization under the apartheid regime, which made me really interested in working with patients or patient groups that are from marginalized backgrounds. I qualified as a dietitian in South Africa, but moved to the UK in 2000. I was introduced to sickle cell and thalassemia in 2011, when I worked in an East London hospital, and in 2012 started working as a social liaison officer in the service that I worked at the point. And that's when I was, first introduced and got to understand certainly sickle cell disease, more so than thalassemia, because in that service there was a bigger sickle cell population. I only became aware of nutrition in both sickle cell and thalassemia in 2014. And then started my doctorate in 2016, facing lots of challenges in terms of my own health, but also academic and studies. And then finally finished my doctorate in December of last year, so not too long ago. So as Stuart said, there's 4 sessions, and I've just listed the 4 sessions. So today we'll be focused on iron and iron overloading, so specifically looking at anemia, malnutrition, and failure to thrive. The second session will be the 13th of March, and there we'll be looking at the endocrine problems. So someone's asked about the enzymes activity, certainly patients needing to take creone. We'll be looking at diabetes, pancreatic insufficiency, and hormonal imbalances in that section. The third session will be the 17th of April, so specifically focused on bone health, osteoporosis, and immunity. And then the 4th session will be on the 1st of May, and that will be looking at the major organs, but also on the gastrointestinal tract, so problems like gallstones, kidney stones, fatty liver, that sort of thing. So coming on to part 1 then of the presentation, and as I said, this is just to give some context for healthy eating in the general population, general healthy eating principles, and then we'll go on to diet and nutrition in thalassemia specifically. So the World Health Organization actually has indicated that diet evolves over time and is quite complex, so it's not a straightforward thing. But it's really important that for all of us that we follow a healthy diet, and this will help to prevent us from developing malnutrition. And malnutrition is both overnutrition and undernutrition, and also developing non-communicable diseases, and that's diseases of lifestyle, sort of diabetes, high blood pressure, cancers, etc. And there's 4 key guidelines that the World Health Organization highlights that all of us need to consider when we're thinking about our diet. And it's about energy balance. So it's about how much energy are we taking in to our diet through the food that we eat, but also how much we expend or burn up. And that's through lifestyles, through activity, etc., exercise. And so it's striking that balance, it's getting the energy balance so that we don't either get in too little and then go underweight and without us wanting to, or go too much and then us gain weight and then put us at risk of developing those diseases of lifestyle. And then it's thinking about the type of fat and the amount of fat that we're having. So going for more healthier types of fats, so more your unsaturated fats rather than your saturated fats. And we'll talk a little bit more about those distinctions there. Limiting overall sugar and salt in the diet. So this is your added sugars that you get from sweet foods, from cakes and biscuits and chocolates and things like that. but then also having the 5 portions of fruit and veg a day. And I'll be interested to find out from the people on the group, there's about 35 of us all together, how many people actually take in 5 a day of fruits and vegetables. So that will be interesting to see later on. So you can see also on the slide, there's a picture of the Eat Well guide. So this is what's been developed by the Department of Health. And it literally it's a pictorial representation of the different food groups that we should be eating, and following those guidelines that I've just gone through, to try and maintain a good level of health, whereby we're taking in the right mix of nutrients from all the 5 food groups. But we'll go into that a little bit in detail. So this slide is also just to show you that in addition to the Eat Well guide, which follows more of a sort of a Western diet from the foods that's in that diagram, there's also the Eat Well guide has also been adapted for different cultural groups, and you can see on this slide. So there's one that's been adapted for the African and Afro-Caribbean population, but also for the South Asian population. And there's one that I saw today that's specifically been designed for vegan people following vegan diets. So you can see that this just tries to adapt the different foods to reflect, the foods that people would typically have within their own traditional diets and cultures. And hopefully moving forward, we can do something similar to this for the thalassemic population as well. So coming now onto diet and nutrition, specifically within the thalassemic patient population. To do this, I've started off by listing some of the main clinical features of thalassemia, because you won't fully understand the nutritional implications if you don't understand what is going on in your body if you have thalassemia. And so one of the key clinical features of thalassemia is what's called ineffective erythropoiesis. So that's a big word, but essentially what erythropoiesis refers to is the process of the body making the red blood cells that flow through our blood vessels. And so in thalassemic patients, that doesn't work as well. It's ineffective. You also have what's called chronic hemolysis, another big term, but what that term just refers to is the rapid breakdown of those red blood cells. So for some patients with thalassemia, they will have red blood cells, but they get broken down really quickly, and so they have to make new ones sort of on ongoing basis. And that can lead to severe anemia and also to what's called hypercoagulability, and that's just the clumping of red blood cells in the blood vessels that can also cause a host of problems. And we all know, if you have thalassemia or you're caring for someone with thalassemia, that the main treatment for thalassemia is blood transfusions, regular blood transfusions, and we'll touch on that a little bit later. And a primary problem associated with those regular blood transfusions is iron overload, so the build-up of iron in vital organs of the body. But also another problem associated with thalassemia is what's called extramedullary hematopoiesis. And again, another big word, but all that means is the formation of the blood cell components. So those components that's needed to actually make the white cells as well as the red blood cells in the bodies. And so you can see there's a number of problems associated with, or clinical features that's associated with thalassemia. And so in terms of thalassemia intermediate, so this is looking at when you have the beta thalassemia major, and also, and usually those patients, and you will know if you have it, will be transfusion dependent or TDT. So you will need to have these regular blood transfusions to sustain you and to keep you sort of well. And then also we have the non-transfusion dependent thalassemic patients, and this can be for patients that have that beta thalassemia minor, but they have a lower hemoglobin level, and so these patients may also sort of have quite a number of clinical problems or clinical features that can affect their overall health, but that can also have implications in terms of nutrition. And so looking to the nutritional implications from those clinical features that I've just mentioned to you there, we know, and it was reflected in the questions that was posed in the beginning, is, what about iron overloading? So we know iron and iron overloading is a huge problem in thalassaemic patients, and this can also lead to the malnutrition, can lead to the anemia, and also to failure to thrive, particularly in the pediatric patient cohorts. The endocrine problems, as I said, that we will focus on in session 2. So for those patients that have pancreatic insufficiency, where they have hormonal imbalances, where they have a risk or they already have diabetes, either type 1, type 2, we will also focus on that in session 2. You may also experience bone health. So that means that you can have an increased risk for osteoporosis, you can have low bone density, and again, we will look at the immunity sort of aspects as well, and that will be session 3. And then for session 4, so some patients will also have problems with their major organs. So you can have things like fatty liver, you can have gallstones, you can have kidney stones, and also a host of other gastrointestinal problems associated with the treatment of thalassemia. So you can see that the nutritional implications for thalassemia is very real, and we do need to do all that we can to support the patients to manage that better. So just generally benefits of nutritional management, and I put this slide together because as a dietitian, I get to see other patients, that require nutritional management, and this is a list of the benefits of nutritional management to those sort of patients. But as I mentioned before, the nutritional implications in thalassaemic patients is no different. And so if we ask for and we put in place the nutritional management for thalassaemic patients by helping patients and encouraging patients to follow a good balanced diet and nutrition, then your patients with thalassemia may also be able to stay healthier for longer. The medication that you take may be able to work a little bit better. There may be a possibility of improving the morbidity, and that's just the complications associated with thalassemia with following a healthy diet. There may also be the possibility of reducing the impact of the side effects of the medical treatment, and we know in thalassemia that's regular blood transfusions. Maybe reducing the frequency and the intensity of the painful crisis. And I know painful crisis isn't usually seen as a problem in thalassemia, but we know that happens for patients as well. Maybe if you admitted to hospital because you have been following a healthier diet and making good choices, that can help to reduce the length of stay in hospital, help you to recover quicker if you are unwell, but also help you to reduce the amount of medication that you may have to take because of your thalassemia. And so hopefully with the information that you will get, you'll be able to see the benefits of that once you start making those changes. I've added the national nutrition standards for sickle cell, which is what I've done for sickle cell disease, but they basically relevant for the sickle cell, for the thalassaemic population as well. And that's why I've included there. And the first one is for dietitians to work as part of the sickle cell MDT, but we know that the service provision for sickle cell and thalassemia, they share the same sort of team. So hopefully, once we've got dietitians in place, it can be for both thalassaemic patients as well as sickle cell patients. So now coming back to the overview of key nutrients for healthy living and taking you back to those 5 food groups, the Eat Well guide that I mentioned. So we'll go through the 5 food groups, and hopefully you'll be able to get some helpful sort of tips as I go through that. I'm just going to move this so I can see. And so the 5 food groups from the Eat Well guide is carbohydrates, and I've just added there the chemical sort of abbreviation for carbohydrates, which is CHO, and that includes foods, starchy foods, breads, cereals, potatoes, rice, and pasta. You've got the fruit and vegetables group. You've got the protein group, so that includes foods like beans, pulses, legumes, meats, and other proteins, fish, eggs, the dairy and milk alternatives, cheese and yogurt. And then we've got the fifth group, which is the fats and oils. And that's the smallest segment, if you take your mind back to that picture that I showed you earlier on. So we'll go through these 5 food groups in a bit more detail. So starting with carbohydrates, I'm just going to keep an eye on the time as well. So with the carbohydrates, the function of the carbohydrates, it's the best source of energy for all the body functions. Your brain needs carbohydrates. The central nervous system needs carbohydrates. Your muscles need carbohydrates to do what it needs to do. And also the digestive processes in the body needs carbohydrates. So it's really important. But also that fats, to digest fats, it also requires carbohydrates. And so you can see that it's not just, you know, for enjoyment. There's important functions that's associated with taking in carbohydrates. So the better source of carbohydrates would be your complex or unrefined carbohydrates. It means those foods that have been less processed and they will have a higher fiber content. So foods like grains, beans, your fruits, vegetables. And then the refined carbohydrates, so those foods that have been processed quite a bit, those foods are particularly important if you have diabetes or a risk of diabetes, that you reduce your intake of those foods, because that can actually cause a sharp rise in the blood sugar level. So we want to take less of those foods. And examples of that would be foods with added sugar, so things like sweets, fizzy drinks, chocolates, cakes, etc. You want to reduce that in your diet. The total amount of carbohydrate that we need on a daily basis, 100 grams. But also remembering, because you do hear of the keto diet where people take in quite a low amount of carbohydrates. So if you are taking in a low carbohydrate diet because you're following a keto diet, that can actually have a negative effect on the kidneys. So the kidneys will have to work a lot harder. They need more water, but that can also result in kidney stones. And so the key nutrients there to think about this group are B vitamins, so your thiamines, your niacins, your vitamin B6, your vitamin B12, fiber, and energy. So this is just an extract from the Eat Well guide to show you the better choices are your complex or your unrefined sources, and so foods that have higher sort of fiber content. You can see there's whole wheat bread, there's whole wheat grain, there's Weetabix, so it can be bran flakes, there's porridge, etc. So taking unrefined options would be your healthier option. So cutting down on sugar, we you know, general population, we eat a lot more than what we need. And so this is just the breakdown of the amount of sugar that we should be having in the different age categories. So you can see 4 to 6 year olds to have 5 cubes, you know, the little cubes that you find when you go to restaurants, they have the cubes in a little cup. 5 cubes, 7 to 10 year olds, 6 cubes, and then from 11 years old to adults, 7 cubes. And interestingly, 1 can of your normal sort of Coca-Cola or your fizzy drinks can actually contain 7 cubes of sugar. So it's really important that you pay attention with what type of foods you're choosing and trying to reduce the amount of sugar. So moving on then to fats, or also known as lipids. So there's 3 classes. So there's triglycerides, you may have heard this or read this, phospholipids and sterols. An example of that is cholesterol. And so you get 3 types of triglycerides. So I've highlighted the saturated fatty acids, which in red, and that's the fatty acid that actually increases the bad cholesterol, and that can increase your risk of heart disease and stroke. So you want to reduce your intake of the saturated fatty acids. And the foods that you get those fats from are particularly from animal sources. So your meat, if you're having meat, your chicken, the fat from the chicken, fat from if you're having pork or if you're having lamb. So you want to remove that visible fat and you want to reduce that so that you can reduce the overall intake of bad fats in the diet. There's also the unsaturated and polyunsaturated fats, which are in green, and those are your healthier choices. In particular, omega-3 fatty acids have been shown to reduce chronic inflammation, and good sources of that would be oily fish, mackerel, salmon, sardines, but also walnuts and flax seeds are good examples of that. Importantly with fats, the function, it performs vital roles in the body. As I mentioned before, we need carbohydrates for fat, to digest fats, but also they are important in terms of carrying the fat-soluble vitamins, vitamins A, D, E, and K. And we look at that in a little bit more detail, but it also helps with the absorption of vitamin D. And we know that for the general population, there is the problem with having lower vitamin D intakes, and the recommendation that we should all in the winter months be taking a 10 milligram of a vitamin D supplement. So moving on to proteins. So again, really important, the function. It's one of the most important nutrients to maintain good health and vitality. It's important for growth and development. I wanted to say at the beginning of the presentation, I hope you have pen and paper to take notes as you're going through, because this is really important information that you can use moving forward. But yeah, so proteins really important for growth and development, and we know that within thalassemia that is a problem. It's a component of all tissues, bones, and nerves. It's a major source of building material for muscles, for blood, for skin, for hair, and nails, internal organs. So you can see how important taking in enough protein is for overall health and well-being. We have to spare protein, and what that means is that if we don't take in enough carbohydrates or fats in the diet, the body will actually use the protein that we take in the diet for energy. So we want to prevent that by all means, because as you can see, protein is a vital, important part of really key building materials, such as your blood, such as your muscles, internal organs, etc. So we want to take in enough carbohydrates. We want to take in enough fats. Some proteins are hormones, so your thyroid hormones, insulin, your sexual hormones, and also that affects the rate of metabolism. It regulates the body's water balance with the help of minerals. Important to note that we can actually lose protein when we are unwell, when we have bleeding episodes, and also when we have surgery. So because you're cutting the tissues, isn't it? And so we need to take in more protein during those times to help rebuild and restore the tissues that are damaged. And so I mentioned chronic hemolysis being a clinical feature or problem in thalassemia, as well as sickle cell patients. And so that leads to high protein turnover, which means we need more. So patients with thalassemia and sickle cell need to take in even more protein in the diet to ensure that it can actually help the body to make those new red blood cells once the red blood cells are broken down. And so that we don't sort of end up losing sort of protein or using protein for energy sources as well. And there's different types of protein. So the better source of protein would be complete proteins. And that means that these are proteins that has all the amino acids that we need, and that needs to come through the diet. So keeping track of time. So moving on to vitamins and minerals. Again, really important nutrients in the body. The function of vitamins, again, absolutely necessary for proper growth. We know that that's the problem for patients, and particularly the young patients with with thalassemia. We need vitamins to maintain health and to prevent disease. And so the body can't actually make vitamins, and so we need to get our vitamins from the diet. So it's so important that we take in a variety of foods to ensure that we get the vitamins. And that's why the 5 a day is so important as well, because the 5 a day is where you will get your biggest sort of input of vitamins from the diet. Examples of vitamins are your water-soluble vitamins. So those your B complex, again, things like thiamine, niacin, riboflavin, of your vitamin B6, B12, folic acid, and also fat-soluble vitamins, which I mentioned when we spoke about the fat. So that's vitamin D, vitamin E, vitamin K, beta-carotene. And some of these vitamins are actually natural antioxidants. We'll speak a bit more when we speak about immunity about that. But just to say that fat-soluble vitamins such as vitamin A and vitamin D are actually natural antioxidants, as well as vitamin C. So it's important that we get in those from the diet. But looking to minerals now, the function, again, vitally important for overall mental and physical well-being. And it's a component of all tissues and internal fluids in varying amounts. And so again, we should be taking in this through the diet, because the vitamins, as mentioned here, plays an important role in maintaining physiological processes. There's key processes in the body, digestion, for example, that requires certain minerals for that to happen effectively. We need key minerals to strengthen a skeletal structure. It's an important part of keeping our health, our heart and our brain healthy, keeping our muscles and our nerves healthy. And I mentioned the water balance as well. And so it's a catalyst for many biological processes, including muscle response, digestion, metabolism, production of hormones, and it coexists with vitamins. And so, again, really importantly, that the diet predominantly needs to be providing the foods that can actually give the vitamins and the minerals that we need to maintain good health, that we need for growth, and we need to prevent disease. So fiber, important. It's particularly in terms of keeping the gut and the colon really in a good, healthy state. And as it says there, it has a major impact on the colon. It helps the muscles of the colon to be exercised and to keep healthy and to move waste products through the digestive system. It helps to reduce the risk of diverticular disease and certain cancers. And again, wheat or bran is an important or an effective stool softener. An example of that is Fagala husk. There's different types of fiber. There's soluble fiber that you will get from your fruits, so pectins, guar gum, but also oats. And oats has been shown to reduce the cholesterol level, so really important function there, but also insoluble fiber, so the one that just passes through the body. And that's important, as I said, in terms of keeping the digestive system really healthy and helping the waste products to pass through the body easily and to prevent constipation as well. Water, again, we can't sustain our health without taking in water. It's a principal constituent of all fluids and all living cells, essential for all of the major sort of physiological processes in the body. So respiration, digestion, assimilation, metabolism, water removal, temperature regulation. Water plays that important role. And so we should be taking in enough water. I know people don't like water. Lots of people say, it's not my favorite thing. I find it really boring. But hopefully this information will help you to understand the importance, the vital importance of taking in enough water. And this can be in the form of squash. All liquids contribute to fluids, but taking in water is your better option. It helps to keep the blood pressure, acidity, and also the composition of chemical reactions in equilibrium, so in balance. And it has been shown that there can be associations between dehydration and chronic joint pain, asthma, headaches, and heartburn. So it's important that we take in enough water. And also just to, side that the brain consists of 78% of water. So we need our brain for everything to sustain us. And so we do want to look after our brain and give it enough water on a daily basis. So that hopefully has given you a really good overview of the key nutrients that we need for overall and general health and well-being. And hopefully this isn't just information that you will hear and not take, and apply. Hopefully you will go away from today and hopefully you've taken notes. Hopefully you've got pen and paper there. You can take notes so that you can actually go over this again and try and make some of the changes. Some of you may already be really good and doing a lot of what I've spoken about, but some of you may need to be making some other changes as well. And hopefully that will give you the information that you need to be able to do that effectively. So coming on to part 2, we'll be looking at diet and nutrition in iron and iron overloading. So this is sort of the focus of the talk today, but I thought it's really important for us to build a solid foundation. And I will be going over these sort of key nutrients in all of the talks because it's really fundamental and foundational for what I will speak about moving forward. So we'll be looking at just very briefly the pathophysiology of the clinical features in relation to iron and iron overloading, the complications, the treatment, but also the management in regards to malnutrition, failure to thrive, and chronic anemia and fatigue. So there you go. So the cause of iron overloading, we know that, as I mentioned earlier, that blood transfusion is the primary treatment for thalassaemia. And for many of you, you would be having blood transfusions every 2 to 4 weeks, depending on your own clinical situation. But essentially, you'll be having regular blood transfusion. And this leads to iron overloading. And a range of complications is linked to this iron overloading. So looking at the clinical effects of iron overloading, and so this basically results in the build-up of iron in vital organs of the body, such as the liver, the heart, as well as the endocrine glands. And some of the problems that you will have in regards to the endocrine problems is as a consequence of this build-up of iron. In addition to that, there's the side effects of the chelation treatment. So you've got your treatment, but then you need to take more treatment to sort of reduce the side effects of that. And that in itself can sometimes be problematic for patients. So they can have side effects, and we'll touch on that a little bit as well. And then cumulatively, that can have nutritional implications for patients, which we'll touch on. So I've included the treatment of iron chelation. You may know this already, but I thought for completeness, I'll mention this just as a refresher. So there's 3 main types of iron chelation treatment. Usually they will use the abbreviations, the DSO or the DFX. I'm going to try and say these terms because they're new for my tongue, having mostly focusing on sickle cell. We don't, I don't really speak about this often, but Thalassaemia, so that's one of the first treatments, and it's given subcut by slow infusion, 8 to 12 hours, so quite a long sort of time frame. And then the Thalassaemia is an oral medication, a 1-a-day treatment, and then deferriprone, which is given 3 times a day. So you may be using one of those or even a combination of the iron chelation treatment. And so it's, as I said, the combination of the iron overloading because of the transfusion, but also the side effects of the iron chelation that can influence the nutritional implications. And so we'll be looking at severe anemia and needing to be treated with the blood transfusions, the regular blood transfusions, and the impact of the iron overloading on malnutrition, failure to thrive, and then the side effects of iron chelation treatment. So managing the side effects of iron chelation therapy. I have thought it important to mention that it's important that if we're going to reduce the iron overload, the primary way to do this will be compliance with your iron chelation therapy. That's why I've included this in the presentation as well. Nutrition can help, but it's the iron chelation therapy that will definitely have a huge impact in you being able to reduce just the sheer volume and level of iron buildup. The diet alone will not be able to do that to the degree that is needed. And so iron chelation therapy is important. So you have to note the instructions for taking your iron chelation therapy. But it's important that you comply with. I know it's tricky. I know it's difficult. You know, we've just seen there that the first one, you know, 8 to 12 hours of treatment is a long time. Taking it for up to 3 times a day takes quite a big toll on somebody. But it is important, and so I want to encourage you through this talk that you try to comply with that as much as you possibly can. Plan your treatment schedule with family, with your carers, and also with your team, so that you have the best chance to be able to maximize your iron chelation therapy, but importantly to note any side effects that potentially is preventing you from, you know, complying with your treatment, you know, to the best of your ability. And so I would say to speak to your medical team about that. But looking at some of the gastrointestinal side effects related to iron chelation therapy, and I've heard from patients that nausea and vomiting is a problem for some patients, and I've just jotted down some suggestions that you can try and improve the nausea and vomiting. It may be that these will only help to ease it a little bit, and you may need to actually have what's called an antiemetic or an anti-sickness or anti-nausea medication. But hopefully by trying this on an ongoing basis, that will help reduce, you know, the need for you to take even more medication to try and you know, manage the nausea and the vomiting. So ginger, ginger ale, ginger nuts, biscuits. I sometimes take that when I'm feeling a little bit sort of queasy or nauseous. Having clear beverages, dried foods, dried crackers, pretzels, toast. Cold foods sometimes for patients are better tolerated when they're feeling nauseous or when they're vomiting. Eating little and often, because sometimes if you're feeling nauseous, you know, you don't feel like having a big meal. So having little and often may be the better approach to ensure that you still get in that range of nutrients that we spoke about earlier on. Some patients find it helpful to have sharper tasting foods when they're feeling nauseous. So grapefruit, sort of lemon tasting foods, and also hard-boiled sweets. For some patients, that's quite helpful. And then reducing the intake of the higher fatty foods, that sometimes can also exacerbate your feelings of nausea and vomiting for some patients. So definitely try to reduce your intake of high fatty foods. These are just some suggestions that you can try. And then if you're suffering from diarrhea, again, so the problem with diarrhea is you're at risk of dehydration. So you do want to have enough fluids. We have already mentioned that fluids and water is quite an important nutrient in the body. So we don't want to be losing unnecessarily fluid because of diarrhea. So having extra water, having squash, taking small sips at a time if you're feeling nauseous might be the better option during that time. And then eat as you are able. Really important, because you don't want to be forcing things down, and then that can make you, you know, feel even worse. So these are just some sort of suggestions that you can try. But I would say if you've tried these suggestions and they're still not working for you, then you can ask your consultant or your you know, the team that looking after you, if you can have a referral to the dietitian who can make even, you know, more tailored suggestions, but also monitor you and prevent you from you know, developing sort of nutritional risks because of these side effects. So do remember to ask to be referred as well. So coming on to the impact of iron overloading on nutrition, and starting off with malnutrition, which is one of the questions that was asked earlier on as well. And so just to say that malnutrition relates to both undernutrition as well as overnutrition. And there's a number of nutrient deficiencies that come to play, you know, when we're looking at malnutrition. So it's the energy side of things, so not taking in enough energy, and that can be through carbohydrates and fats. Remember, I spoke about protein. So, you know, we want to take in enough energy, we want to take in enough fat so that we don't use our protein stores for energy. But also the vitamins and minerals, you know, not getting in enough vitamins and minerals through the diet. These gaps in the nutritional intake can all relate or result in malnutrition that needs to be addressed. And this definitely has an impact on poor health and well-being outcomes for those affected by malnutrition, both under and over, as I mentioned. When we're looking at failure to thrive, and this is certainly in the pediatric patient cohort, this is related to malnutrition and, again, nutrient deficiencies. When we're not taking in enough of a mix of the foods, remember the 5 food groups I mentioned, the carbohydrates, the proteins, the fruits and vegetables, the dairy products, as well as the fats, that can definitely result in malnutrition, but also result in the failure to thrive in the younger pediatric patient cohort. So we want to address that as soon as possible and not allow that to go on for too long. Failure to thrive and malnutrition is also related to the severity of anemia, and that is the availability of oxygen to cells, tissues, and organs. So we want to ensure that we are getting in enough sort of oxygen as well, you know, in the bloodstream, and so taking in enough nutrients to try and help with the making of this new red blood cells that we need, that you need on an ongoing basis. So that's important to note, but also being able to maintain normal growth and development. So with failure to thrive, what you find is that patients struggle with normal growth and development, and we have now seen that it takes a lot of nutrients. It takes all of the nutrients. It takes a range and a variety of nutrients to ensure that, you know, we can maintain and improve normal growth and development. This can also affect a patient's energy levels and normal activity, and definitely affect the quality of life of the children affected by failure to thrive if not treated promptly. So it is a significant problem that needs to be addressed. And again, in these cases, I would say, if you are struggling and you haven't yet been referred to a dietitian for support with your child, then I would highly recommend that you ask your consultant or your team to make that referral to get that extra level of support. So we're looking at the nutritional management of iron overloading. So this is to answer the question that was posed right in the beginning. So patients with iron overloading will have to limit the amount of iron taken in through your diet, because as we've already mentioned, that there's a build-up of iron in your vital organs, and so you definitely don't want to be taking in any more iron through the diet, because that will just exacerbate and make that worse. Iron is really well controlled in the body, and there's different processes within the body, within the liver, that can help to release stored iron if need be. But certainly the amount of iron overloading that we see in thalassemic patients, you know, we want to do all that we can to reduce the amount of iron that we get in from the diet and not make that worse. And as I mentioned before, please be compliant with your iron chelation, because it's the combination of iron chelation and making those changes in the diet that is going to help you get the best outcome in relation to iron overloading. So what can you have in your diet? You can have fruits and vegetables, and we know the fruits and vegetables is going to give us the vitamins and the minerals that we spoke about earlier on. You can have grains, you can have legumes. That's your unrefined carbohydrates. Again, that's going to provide the body with key nutrients, but also with energy. You can have eggs, because that is a lower sort of iron content. You can have lean protein sources like chicken and turkey. So in the case of iron overloading, we are saying effectively, if you are having red meats, to reduce your intake of red meats, because that has the heme iron, and the heme iron is the one that is readily absorbed, and that can definitely add to the iron in the diet, and we want to reduce that by all means. So someone asked about black tea. So definitely black tea, tea and coffee can help to reduce iron absorption. So even if you're having your lean proteins like your chicken and your turkey, eggs, etc., you want to have tea and coffee sort of whilst you're having that, because that will just help to reduce the absorption even further. Also, you have to limit the intake of vitamin A and vitamin C rich foods, because these foods actually enhance iron absorption. So when you're having your meals, pay attention to your vitamin A, so your orangey sort of type of foods, and also your vitamin C rich foods, your citrus fruits and vegetables, because that can actually increase your iron absorption, and we want to reduce that as much as possible. So definitely pay attention to those. Don't take foods that are fortified with iron. There's a lot of breakfast cereals, and you will see on the front of the box, it says fortified with iron. You want to read your label so that you can identify and reduce your intake of taking foods that's fortified with iron. And again, you want to avoid any supplements that contains iron. So this, in a nutshell, are certain things that you can do, really important in terms of the diet, that you can take to help reduce the amount of iron through your diet. So looking at malnutrition, and I'm going to speed up a little bit because I'm just cautious of the time. So malnutrition, again, we want to enhance and promote growth and development and prevent people the failure to thrive, but also the risk of weight loss. And so, as I mentioned before, key nutrients to pay attention to: protein, taking in enough protein in the diet, having enough energy from carbohydrates and from fats, your micronutrients, and this is your vitamins and your minerals. You want to be taking in enough of that, and if you're not, then that can increase your risk for malnutrition. But also, patients, if you have a reduced appetite because you're not feeling well or you're feeling nauseous, that can also, over a long period of time, increase your risk of malnutrition. Reduced food intake and then weight loss, all of these, they increase your risk for malnutrition. And certainly if the child has failure to thrive, you want to reduce this as much as possible. What can you do then if you have malnutrition or failure to thrive? You want to fortify your foods and drinks. And when I mean what I mean by fortify, you want to add in extra carbohydrates. You want to add in extra fats, to try and bulk up the energy, bulk up the protein content as well. You want to have energy-dense foods, so foods that contains quite a lot of calories in a small volume. And the next slide will give you some examples. But also eating little and often, because if you do have a reduced appetite, you won't want to eat a big plate of food. So by having little and often throughout the day, that can help you to actually get in the amount of overall nutrients, calories, energy, protein, and to prevent weight loss. Some patients at risk of malnutrition or failure to thrive may have to have oral nutritional supplements. And again, this is prescribed by the GP, or if you're an inpatient, by your consultant or by the dietitian, or recommended by the dietitian. It does require you to be assessed by a dietitian. You do have some over-the-counter options that you can get as well. And they come in different formats. Some are made with milk, or the sachets that you make up with full fat milk, and some are ready prepared, ready sort of to drink. And there's a variety of these options because there's different companies that make them. But essentially, the next slide will just give you some suggestions of how you can fortify or enrich your drinks, your cereals, soups, porridge, mashed potato, particularly for when you have a low appetite, when you have reduced intake, and this will just help to get in that extra amount of calories, protein, and energy as well. So some practical tips to manage failure to thrive in children. Again, with children, each child will have their own growth chart. So you need to track your child and their growth chart. And again, either your health visitor will help you to do that. And if you need, and if you have been referred to a dietitian, they will also help you to sort of track your child's growth along the growth chart. If the child is continue to with failure to thrive, or they're at risk of malnutrition, then again the referral to a pediatric dietitian is, I think, a really important next step to get that additional support, to get that additional advice, and offering foods little and often, like I mentioned before, fortifying foods, and they may again suggest that the child needs some oral nutritional supplements during that time. Some practical tips that you can do: offer food from a variety of food groups at each mealtime as much as possible. Offer healthy snacks to boost the calorie and protein intake as appropriate. Again, your child will guide you with this. For the older child, you may want to involve the child in shopping. If they're fussy eating, you may want to involve the child in shopping for healthy options, get them to choose off the shelf, use the Eat Well guide, again, as education, and help them to be involved with either shopping or even food preparation, or suggestions of foods that they may want. Again, as appropriate. As a parent, you will know where your child is at and what your child is able to do. And if you are introducing a new food, then definitely only introduce one new food at a time. So failure to thrive is a big problem. Maybe, as I said before, you may already be trying some of the things I've already mentioned. And if it's not working, definitely get yourself, your child referred to a pediatric dietitian, where you can get that additional support, because what we want to reduce is that risk of malnutrition, and also the knock-on effect of that is that can negatively impact on the child's sort of overall growth, development, and also just overall health outcomes. So chronic anemia and fatigue, so associated with tiredness, low energy, and many of you will be experienced that, or may have experienced that. I mean, I had anemia, a while ago, and I know what it feels like. And I don't have thalassemia or sickle cell. I know it's not a very pleasant thing to experience. And again, in the case of where you're feeling tired, where you're feeling low energy, eating little and often might be the best approach, again, so that you don't reduce the total amount of energy, total amount of protein, and increase your risk of malnutrition because of that. You want to choose energy-dense foods. Think back to the slide. I showed you the example of how to fortify different foods. And you also want to, in this case, and note in brackets, if not iron overloaded. Please, if you are iron overloaded, then please, but as I mentioned before, then you have to reduce the iron foods from your diet. But if that isn't a problem for you, then definitely you can have a little bit of iron in the diet. But I would suspect that in thalassemia, and certainly in thalassemia major, that you probably won't be able to do that. Examples of increasing folic acid in your diet, and folic acid is a vitamin, a B vitamin, that is important for that. Remember in the beginning I spoke about erythropoiesis. So it's to help make the new red blood cells. So again, folic acid is a good vitamin there. And examples of food sources would be green leafy veg, broccoli, avocado, citrus fruits, whole wheat. So all of those foods will be able to help you to get in a good amount of folic acid from the diet. And importantly, if you are suffering with anemia, to do gentle activity and exercise, not running, not cycling, but gentle activity on an ongoing basis. That will have a positive effect just generally on your overall health and well-being. Looking at fatigue is more complex. It's related to the anemia, but there's a number of other factors that can actually also feed into your experiences of fatigue. It can be physical, it can be emotional, it can be mental, environmental, and certainly living with thalassemia and the complications associated with thalassemia. I can imagine that can definitely have an effect on your mental health, on your emotional health, on your physical health as well. And so, there's lots of things to think about. And there was a question about, how do I prevent eating sort of the high fat, high sugar foods when I'm fatigued? And that does come down to planning. It does come down to planning, because you can't be thinking about what to eat when you're feeling fatigued. So it's important that if you know that that is something that you struggle with on an ongoing basis, that you plan your meals, that you plan what can I have. It may be that it's some of those fortified meals and shakes and drinks that I mentioned earlier that you have to hand, that you have in the fridge, that you can go for that rather than the crisps or the chocolate on an ongoing basis. There's no problem in having that as a snack, but if you know that fatigue, you have that on an ongoing basis, then you want to think about sort of planning what you have in the cupboard or what you have to hand to prevent you from making those choices where you're not getting the mix of nutrients, a quick fix, a quick sugar burst, but not getting the nutrients to sustain your health and well-being. Right. So I've come through the bulk of the information around the diet, what to do in terms of managing the malnutrition, in terms of managing the failure to thrive, the anemia, the fatigue. I'm also just helping you understand a little bit about the effects of the side effects of the iron chelation medication, but also the iron overload. So quite a lot of information. I'm probably overloading you with information, but hopefully you found it helpful and beneficial. So I think if it's okay, we can have a 5-minute comfort break, but if you'd rather continue, then, I'm happy to continue at this point. So I'll be guided by you at this point. What do you think, Stuart? And
I think now could be a good time to have a quick look at some of the questions that have come in through the chat
yeah,
while you've been talking.
okay,
The most
brilliant.
recent one was on should a child be prescribed folic acid as a supplement?
And how old is the child?
Good question. 7.
7 years old. Because with the vitamins and minerals, we should be able to get the folic acid from the diet, if we're having a variety of foods. If the parent knows the child maybe, had failure to thrive, or they have a reduced appetite, or they're fussy eating and they're not getting that mix of nutrients that we spoke about earlier on, then there is an indication in that instance that the child may benefit from having a supplement. But again, it would have to be specifically for that child's age range. Yeah, it would have to be like a pediatric sort of prescription. I don't off the top of my head know sort of what the micrograms are, but in the event that the child is not able to eat a variety of foods, then definitely that would be indicated. I would also say in that case, maybe a quick review from a pediatric dietitian. My background is adult, so I'm not so familiar with the pediatric side of things. But I would say if there's concerns, then definitely just get them referred to a pediatric dietitian. I can find out as well, and sort of as we go along, sort of mention and be able to give that information at the next session. But yeah, definitely if they're not taking in the variety of foods from those 5 food groups in sufficient amounts, and there's a risk of potential malnutrition, then I would say a supplement is indicated. And that goes for adults as well. If from what I've said tonight, and from the range of foods that you should be having, and you're not doing that, even just in terms of your 5 a day, then there's a strong indication that you should be having a supplement. But also, particularly those patients who are on the regular blood transfusions, there is consensus that they should be taking a multivitamin mineral that does not contain iron, because of that regular sort of, the transfusion. You may benefit from actually having a multivitamin mineral without iron. Yeah.
Thank you. I just wonder again with time, whether how long do you think the rest of the content will take to get through?
So
Professor's
let me
cracking on.
continue, because I've allocated a Q&A time. So let me
Okay.
finish the presentation and then we can end off with Q&A if that's
Yep.
okay. Yeah. Shall we do that?
Yes.
Because the next couple of slides is literally just lifestyle and empowerment, and it's just helpful tips and daily actions to help you improve your health and well-being. So I'll go through this, and then we'll have that the question time to complete the session, because it's now 8:15, and we're meant to finish at 7:30. So I'll just run through this really quickly. So the reason why I included this is because you will know, living with thalassemia, the complications associated with the treatment, with the condition itself, that your overall health and well-being does take a knock, because you're having to manage quite a severe a condition, a chronic condition, on a day-to-day basis. And so it's important that you do look after yourself, and self-care. And I don't know if you get a chance to do this, but this is something that I like to include in all of the presentations that I do with patients. Self-care is essentially anything that helps you to improve your quality of life. And it's for all of us. Certainly, if you're living with a chronic condition, it's important, but it's for all of us. And so I want to encourage patients to take some time out to think about, what am I doing to improve my overall quality of life? And when I looked at the definition of quality of life, the World Health Organization actually identified 4 key things when you're looking at the quality of life of a person. And they speak about goals, they speak about expectations, standards, and concerns. And I wonder, for the audience listening, do you have goals? Do you have goals for yourself in terms of either your health, or in terms of, studies, or things that you want to do? What are your expectations, for your health again? The things that make you happy, the things that you enjoy doing. The standards, what standards have you set for yourself? Or you just happy to go by? Or, have you taken the time to think about, I'm happy with this, but I'm not happy with that? And what are your concerns? And so these are things I want you to think about. Maybe you have goals for yourself, maybe you have set standards for yourself, but maybe you haven't. And so I want to encourage you to think about, from those 4 things, what is one thing that you can do that you haven't done already, that can work towards improving your quality of life. This slide is a busy slide, but all the slide is saying is that your quality of life, self-care is multifactorial. There's a lot of things that can actually influence your quality of life and your overall health and well-being. And there in the yellow blocks, I've mentioned the spiritual things, there's physical factors, there's emotional factors, your level of happiness, your motivation. All of those things can actually have a role to play in your quality of life and your health and well-being. And so paying attention, and I mentioned some of these things when we spoke about fatigue. Fatigue, as I said, it's multifactorial. There's a lot of things that can feed into your feelings and experiences of fatigue. And these are some of the things that you need to consider as well, in terms of your quality of life, but also in terms of health and well-being. Nutrition being central, for me, it's really important that all of these things can actually have an impact on nutrition. You know, if you're empowered, if you have a good belief around nutrition, you will take positive actions in terms of choosing good, you know, healthier options. If you're feeling physically well, you know, if you're physically active, if you're able to do things, you know, do some little bit of exercises on a daily basis, that can also boost your choices. But if you lack energy, if you're not feeling, you know, you've got strength, that can also have an impact on what you choose. If you're happy or sad, you know, that can have an impact on what you choose. Do I have the chocolate bar? Or do I have the 5 a day, you know? And certainly on the mental health, the motivation to do the right thing and to take daily positive action. So this slide is just to show that there's a couple of things that you need to think about as well. And then some things that you can do daily in terms of empowering, you know, to improve your overall health and well-being practices. So take daily positive action to improve your quality of life and your health and well-being. Be proactive. Practice daily self-care. Do one thing, light a candle, go for a walk, phone a friend, you know, whatever. You know, that really feeds your spirit and so forth. Make daily good nutritional choices. You've had a good overview of the Eat Well Guide and all the different food groups and nutrients. Keep active daily. There's a recommendation for 30 minutes of activity 5 days a week for all of us. If it's possible, some of you may not be able to do that, but as far as possible, maintain good relationships and remember to ask for what you need. Some of our patients don't know to ask. Do remember to ask for what you need. So that concludes the presentation. Yeah, so now is the time for questions, you know, any more questions from the chat or from the audience. We've got 4 more sessions. If I haven't been able to answer your question from today, it will carry over. And when I start the session, I will take some time to answer those questions there. So please, you know, it's not lost if we don't have enough time to answer your question today. But thank you so much. Yeah, any questions?
As people gather their thoughts, I'll just run through a few of the more recent ones in the chat as well.
Yeah.
There was a question around whether or not it's okay to give a 2-year-old tea.
Again, it's tricky. So I think the next session I will have to do a little bit on sort of the within the pediatric group. I would say a 2-year-old is still developing, is still growing, and so there is this balance between the getting in enough fluids and getting in the milk, obviously, to get the protein. And so I would be cautious in terms of tea, and also maybe the volume of the amount of tea that you give to the child. If this is in regards to the iron overloading and the child is experiencing iron overloading, then that's a different sort of conversation to have. But I will double check. As I said, my experience is not pediatric, so I will double check that. And hopefully at the next session, I'll be able to just give a little bit of a summary and overview so that, you know, you do get the answer to your question. But for me, the priority with a 2-year-old, because they're still growing, they're still developing, the teeth are still coming through and all of that, you know, the primary objective there is to get in the protein from the milk, getting in enough, you know, carbohydrates, etc. I'm just sort of cautious in terms of the impact of that it may have on absorbing some of the nutrients that's essential for the child at that particular age. But I will double check.
Right, there may be a few more pediatric related questions.
Yeah, I thought it may be the case, but as I said, not to worry. I will add that onto the next session, so I'll leave some time so I can answer some of those questions in the next session on the 13th.
Great. So the next question is around just generally what can help with increasing metabolism.
Oh gosh, the metabolism is in relation to the overall health and well-being, in relation to the overall intake of the micronutrients that we spoke about earlier on. If you're not taking in the, remember when I spoke about the vitamins and the minerals, and even water, those nutrients, they play an important role in all of the main sort of physiological processes in the body. So if you're not taking in that mix and the good variety of vitamins, minerals, but also your carbohydrates, your proteins and your fats, that can cumulatively have an effect on your overall metabolism. In thalassemia, we know that there can be an imbalance in the hormones that have a role to play. So the thyroid hormone, for argument's sake, that has a role to play in metabolism. If that is the case, then, you know, it's important at that point to work with the patient to see what are they having within their diet. If there's any gaps, try and improve on those gaps in terms of, you know, adding in extra foods that's going to help to maybe cover the nutrients that may be missing from the diet. And that, I think, would be the best approach to try and maximize the level of metabolism, working alongside the fact that the patient may be experiencing a reduction in metabolism because of a complication of the thalassemia. So it's going to be tailoring, finding out what their current diet is, what might be the gaps, adding in the gaps, and then building on that to ensure that, you know, it's not having a overall negative effect on their risk of malnutrition, both over and under, if that answers the question.
Thank you. Now, just because we've got some of the questions that can be checked later on, we'll go to the two hands that are up, starting with Hafsa.
Go ahead, Haifa. Oh, Hafsa.
I think Hafsa is first.
Anyone. We've got a few minutes.
I think Haifa and Hafsa are very close, so we're getting confused.
We can't quite hear the question.
Shall I go?
Haifa, your audio is
Okay,
really struggling. If you could pop the message in the chat,
I don't know where
we'll pick that
Hafsa
up.
is. Hear me?
Yes, Haifa, we can hear you now.
You can hear me?
Yes, but it's a little bit
Okay.
of a delay.
What do you, it's fine. If it's difficult, I'll just pop it into the chat.
Yes,
chat,
if you can do that.
if that's okay.
Yeah, if you do that, that would be great. And then maybe Haifa, you've got your hand up. Maybe you can ask your question.
No, that was me.
Let's have a look.
So
I think,
in the meantime, I'm seeing there's a question, would collagen help? I'm not sure what is it that Ida help in what regard?
Would collagen help?
Will collagen help with the bones?
Again, to best answer that question, it's best to look at the overall diet of a person, because if you just look at one nutrient and you don't look at sort of what else you're having, it's really difficult to sort of gauge, because it may be that there's in terms of bones, if you're thinking about vitamin D, or you're thinking of calcium, or you're thinking of phosphorus, if you're having all of those foods that provides that may be able to address, or, you know, the problem that you're experiencing. Collagen on its own, I'm not quite sure about collagen on its own in terms of bone health, but I will make a note of that. And when we speak about in session 3, we'll be speaking about bone health and immunity. I will definitely sort of try and cover that as well. But it's about the overall, it's about looking at the overall diet and looking at what is in, what are the gaps, and what do we need to put in. You know, that's the approach that we would normally take as a dietitian, so that we ensure that you're getting in that mix of nutrients that I spoke about, to ensure overall good health and well-being. But I will look into that as well.
Thank you.
There's another question from Liber. What do you think of 72 hours of fasting for thalassemics? What would be its impact on iron overload and red cell generation?
That's quite a loaded question. What is there a reason for the fasting? Because with iron overload in thalassemics, if it's because you're having your chronic, your blood transfusion, you know, you are going to be building up iron on an ongoing basis, and the fasting for 3 days, it's not going to make that big of a difference. So it's the combination of you taking your iron chelation therapy, as I mentioned earlier on, and by trying to reduce the total amount of iron that you're taking in through the diet on an ongoing basis. I think it's that combination that's going to get you the best kind of outcome and results, sort of long term. But 3 days of fasting necessarily, I don't think that's really going to sort of add much in the long term, if that makes sense.
Sorry, can I try and piggyback on that question if you can hear me now? Can you hear me?
A little bit.
You can't hear me. I can see it. It's just, you said the impact on iron overload, right?
Yeah.
And so my question is always, if we're doing well with iron, do we will always have an overload, because even if we're doing well, we're overloaded. But how much is that diet making a difference? Because if it's not making a big difference, we have so many things to worry about that I'd rather not do the diet. Just eat normally. I eat my red meat. I eat my vitamin C, food, rich foods, etc. And I'm doing fine. So why do I need to change that diet?
So that's a really good question. And the way that I would want to answer that is, it is about your overall quality of life. I've just mentioned that in that last, it's about the overall quality of life. And no one can make you do anything that you don't want. So that's just to say that, you know, it's your choice to do that. What this is to give you some sort of tool, some sort of information that can help overall to improve on the overall quality of life. If you find that by not making the changes to your diet, by eating your red meat, and you're able to do, you know, what you do, and you're okay with that, then it's down. Everybody has a choice in how they want to live sort of their life. But I would say, and the purpose of these talks is to provide information so that you can make an informed decision as to how, you know, you want to impact on your quality of life, be it that it stays the same, or be it that it's improved. And for thalassemia, you're absolutely right, it is a lifelong process, because you will always need to have your blood transfusions. But if through the diet, there was one slide where I said, you know, if by improving your overall diet and making those changes, you can feel a little bit better within yourself. You can reduce your risk for malnutrition. You can reduce your risk, or if if you are unwell, where normally you would be unwell for, let's say, a week, for 7 days, as an example. But now it's because you're making these positive changes. Now, instead of staying, unwell for a week, you're now only staying unwell for 4 days. If it, and that's what we're getting on, and that's the purpose of this information. It's your choice, but it is about how can we almost create an environment, where we can, through diet, long-term, alongside your medical management, try and improve your health and well-being. I hope that answers the question, or helps in some way.
I think
Yes,
that's
yes,
a good place
yes.
potentially
It's
to round
more
up.
seeing it more holistically, and maybe pick and choose it, seeing it more holistically.
It seems we've lost your audio again, Hiva. But I think probably agree that's a good place to wrap up. We're slightly over time, and like Dr. Matthews says, it is about personal choice. We provide, hopefully, with the information that you need to make informed decisions, and then it is down to personal choice. So thank you to everyone for joining, and thank you
Before we wrap
to
up, Stuart, what I would encourage everybody to do, if you have any further questions, Haifa, you could also just submit it directly to the office, and then we would be able to get that on to Claudine and get some answers, so she'll be a little bit more prepared for the next one in terms of what questions. We're also going to be putting the recording that we did today up on our YouTube channel, and we're going to pass it over to Stuart for the Red Cell channel, and it is going to be available. So if there is anybody that would have missed the session today and would like to review it, please encourage them to visit the YouTube channel. You can have an email to you can use, I'll put my email in the chat so that you can contact me directly, and we can go from there. So over to you, Stuart.
try and get you back. I've been kicked out a little bit here. Okay, yeah, so like I say, pop the emails across to Romaine. She's just popped the email address in the chat with the YouTube channel and where it's available online. I will share the Red Cell Network's website. A bit of a plug, you can subscribe to that website for some targeted information sharing for more sessions like this that may benefit yourselves as thalassemia patients across the network, and just keep up to date with any major news developments. We won't spam you with things that won't be relevant. And yeah, I suppose just last thing to say is, again, thank you to Dr. Matthews for a lot of information. Good information to take forward. We've got a bit of a break now till the next one. I believe that's the 13th of March. 13th. Is that correct?
Yeah.
Yeah. So plenty of time to absorb and make the small changes, and then we'll come back for the next session on the 13th. If you found it useful, please do come back and share as well with people who that might not have attended tonight that may benefit from future ones. And again, I've popped the registration link in the chat as well. So anyone who attends the 4 sessions will receive a certificate of attendance, just to show that you've dedicated the time. So yeah, thank you to everyone.
Thank you.